Okay, we're going to talk about health policy and focus on aspects of defining it so that you know how to recognize health policy. We will talk about a few concepts, primarily classifying it in the forms of big P and little p policy. But before we do that, let's pause and reflect for a moment. When we talk about policy, we must first recognize that policies are socially constructed phenomena. They are products of our values, expressed through rhetoric and with symbology that is culturally specific. So before we dive into definitions, we can think about the fact that it really is a social phenomena. An example of that might be sexual health education. So here we have something that's encouraged at federal level, but determined at state and local level. Recall that the state government has the primary control of public health. And so there are limits, for example, on what we can do. And in sex education, there are limits on our speech, things we can say, we cannot say, things we can discuss. From here in U.S. schools here to clinics in Mozambique where we federally fund programs. All of these things are reflections of our values and priorities. Those are encoded in policy. So policy isn't something separate from us, but it is a creation by us. Culture mediates what we can and can't do, how we understand health, how we understand who should have it. And so policy is both a structural and a social entity. Let's stop for a moment and think about the top 10 public health achievements in the 20th century. See if you can think about a few of these. What are the big things in public health? The really large achievements. I would suggest to you that these achievements have to do with safety, with preventing exposures, with populations, with structural changes. Some of these things you may recognize, some of these things you may not recognize. Safer, healthier foods, control of infectious diseases, family planning, vaccination, motor vehicle safety. These are the top 10 achievements of the 20th century because they have in fact made a huge difference on population health worldwide. So as we're here talking about health policy, we have to say and ask ourselves, what is the role of policy in these achievements? So let's take a look at a few of these examples. Let's take vaccination. So the role of policy would be mandates and funding to increase access. So the function of policy would be to increase access through school health requirements, for example, school entrance requirements. You must vaccinate your child against this or that. MMWR or measles, MMR, measles, mumps, rubella. We're talking also about human papillomavirus, and there's a variety of positions on that. But these are all about increasing access. So the role of policy here is to increase access. We have requirements for motor safety, speed limits, safety belts, helmet laws. States do not receive federal funding for highways if they don't have particular safety limits, speed limits, for example. But helmet laws are determined by state. Infectious disease control policy provides for the funding or the standards of care, recommendations, quarantine, mandated therapy. When we think about healthier moms and babies, programs, laws, initiatives. Same with food safety policy assures the requirements for food safety, handling, labeling, inspections, requirements. Workplace safety, again, laws, initiatives. You can start to see a pattern, I hope, here. So how is it that policy fits in? Policy decisions impact a broad range of factors that influence the distribution and effects of social and other structural determinants of health across populations. Policy is a structural determinant of health, but it also affects other structural determinants. It's a strategy to improve health, whether by advocacy or policy development. And it's a reflection, again, of how we define health. This gets back to the comment earlier that policy is a socially constructed phenomenon, and culture mediates policy. So what is then health policy? What is it? If these are examples of policy, what is health policy? Can we come up with a definition? So I've taken the definitions offered by several colleagues in the field and offered to you something summative. When we think about health policy, we're talking about authoritative decisions made and actions taken by governments that pertain to health. Now, what do I mean by this? Well, I'm talking about governments at local, state, national, and international levels, or tribal governments. Formal governments or governmental organizations. We think of international health, and we have the World Health Organization and its association of member countries. Context, content, process, power, all have to do with health policy. Health policy includes structures and functioning, actions, outcomes of government, all related to the health of individuals and populations, directly or indirectly, whether a policy specifically about health or whether there's a health implication about policy. So health policy includes several things then. You can start to see the slide populate here. Structures and organization of government, decisions, rules, goals, regulations. Behaviors, organizational behaviors and structures. And these two sets of things reinforce one another. They're iterative. Decisions and rules, requirements, laws, ordinances create or reinforce certain organizational behaviors and structures. Those organizational behaviors and structures reinforce or create new programs, plans, goals, regulations, etc. So there's this relationship between those two sets of things. And policy is experienced differently by different people. Let's think about an example from immigration health. So you are a member of an immigrant population in the United States, and you live in a state where English is the language of choice and the official language of the state. All health information and communication is in English. You now are calling for a particular test at a health department, or you want to immunize your child, and English is not your first language and you're really not good at it. You may not understand anything. And that governmental organization does not need to speak to you in your language and put money toward the speaking to you in your language. So you can imagine the disconnect there. For English speakers, they may not even notice that policy. Think about the policy of Medicaid expansion under the Affordable Care Act. Those who are insured through employment are probably watching the Affordable Care Act expansion with interest. Maybe they have opinions about the problems or the challenges that we're facing. But imagine yourself as someone who might be eligible for Medicaid were it expanded in your state. And it's not. And so you're experiencing these policies differently because of who we are. We call that policy target populations. So there's a way of thinking about policy, if you will. It's just an organizational way, rather. This is really work of Ross Brownson, and I've added a few things here. If we were to think about policy and types of policy or how it might be defined, I would suggest there are two big buckets. And this is a very simplistic way of thinking about policy, but it'll help you along the way if you do no more thinking about it. I would suggest that we think about policy as big P and little p. What is the difference between them? So big P are things that established policy bodies do, state and federal, in this case in this country, for example. So that would be formal laws, rules, regulations. Think state legislatures, think congressional body, federal. Think courts, court rulings, organizational and financing of health government, policy statements. Why do I include funding in formal laws? Because appropriations are expressed in bills. They are laws. A program can be created by one law, if you will, a bill that gets passed, but it is not funded until an appropriation is made for it, and that is a bill. That's a spending bill. In the international context, the big P would emanate from World Health Association. So this would be the country organizations of the World Health Organization, and they gather together to determine policy, and it functions a little bit differently than we might think in our American context. Elements of WHO, such as PAHO, in the Caribbean area, that is literally functioning as a government. So their actions would be big P. Now, little p are not things necessarily that have a little impact. So this is not about the size of the impact. This is about who does it. Little p are things that the administration does to implement big P. So regulation, funding guidance, organization and financing of health programs, norms, plans, etc. Big P and little p both can have large and small impact. So when you think about little p policy or big P policy, it's not about the outcomes. It is about who is doing it. Let's take an example here from cervical cancer. So in cervical cancer, the big P here would be funding for cervical cancer from the Breast and Cervical Cancer Early Detection Program. That's encased or encoded from federal law. So that big P would be the federal law that created and funded that program. Now, little p related to it, of course, is the fact that the Centers for Disease Control and Prevention that manages or implements that program has rules associated with it. State funding, states match funding if they can for this program. Also related to cervical cancer would be HPV mandates for vaccine mandates for school entrance, USPSTF, which is the U.S. Preventive Services Task Force, and the Institute of Medicine recommendations. Those are all big P kinds of things. Now, USPSTF and IOM are big P because they are acting on behalf, they are creations of the federal government. They say they're independent bodies, but these are really quasi-governmental in many ways. Little p here would be the organization of the system itself and its state level, fragmented state health systems, and the fact that programs don't speak to one another in cervical cancer, and there's very little what we're calling sphere of control. Medicaid funding, standard of care, all these things are determined by policy at the small p level, and they can have a huge impact. The Rube Goldberg very confusing state health system makes a huge impact on a woman or populations of women who are uninsured and need cervical cancer screening and follow-up colposcopy. They can't navigate through that system of brokenness. So that little p scenario, that fragmented health system, makes a huge impact. Well, let's see if we can test your knowledge. Big P or little p. June 28th, 2012, Supreme Court ruling on National Federation of Independent Businesses v. Sebelius. You guys are probably very familiar with this. Is this a big P or a little p? This would be a big P. How about the National HIV/AIDS Strategy for the United States? This came out of the Obama administration. It's a national plan bringing forth the assets and the attention of all of the agencies. Would this be big P or little p? The question you should be asking yourself is not what it is, plan, but who did it? And this came out of the Obama administration, the president's action. This would be a big P. And it had a huge impact because its focus or its refocus on reducing infections and linking people to care determined then the funding direction of HRSA, Health Resources and Services Administration, that handles a lot of the treatment for HIV and organization of the system around it, and the CDC, which handled the testing and follow-up. So this big P thing had a huge impact, and lots of other things occurred as a result of it, other little p things. Big P or little p, U.S. Preventive Services Task Force, guidelines on cervical cancer screening. Big P or little p? One might say screening guidelines are probably little p. Nope, big P, USPSTF. Who did it? Here's two things. If you look at the top of the slide, Indiana Tobacco Use Prevention and Cessation Trust Fund. The trust fund was created by the Indiana General Assembly. That's our state legislature. That was in 2000, and it created an agency. So an agency was created. Would that be big P or little p? The creation of an agency by the state legislature. Big P. Now, if you look at the bottom of the screen, House Bill 1001, it abolished that agency and gave the assets to the Indiana State Department of Health, creating the commission that is in existence today. Big P or little p? Who did it? House Bill. Legislature. Big P. Big P, little p here. This would be the February 2013 HHS guidelines or final rules on essential health benefits and actuarial accreditation. Taking a look here, you'll notice the Federal Register where it's printed is dated November 26th, but that's because those rules did not change. They were proposed, people could have an impact and give input, but those rules as printed on the 26th of 2012 became the final rules in 2013, February. Big P or little p? Who did it? HHS released final rules would be little p. And the Institute of Medicine reports Future of Public Health and the Future of Public Health in the 21st Century. This had a huge impact, the 1988 Institute of Medicine report. The 10 essential services, 3 core functions, the reorganization and redirection of the public health system of accreditation, all emerged from the thinking that occurred around 1988. Huge impact. Future of Public Health in the 21st Century continued that work. Big P or little p? Now, folks can argue that it might be a little p, but it is a big P. Public Health Accreditation Board. This is, I would argue, one of public health accreditation at local level. State and local level is probably, I think, the most important policy agenda facing public health. Because it is literally calling us into a different structure, functioning, and political standing. So the question is, let's take the first sentence. Rush County in Indiana, the Rush County Department of Health pursues local health accreditation. That decision to pursue accreditation, big P or little p? Little p. Health Department. Now let's look at the second sentence. County Commission, this would be Rush County. Their commission supports the county's application for local health accreditation. Big P or little p? Now this is a trick question. We have the county commission, so one might say big P, but the question would be, what is it? A statement of support, a letter? Did they pass an ordinance? One could argue either way. Okay, in 2009, Congress lifts the federal ban on the use of federal funding for syringe exchange programs, and they reversed the decision in 2011. Big P or little p? Who did it? That would be a big P. Now, the Indiana HIV Prevention Community Planning Group, this is the group of people convened by the State Department of Health from all over the state. They prioritize the syringe exchange program for state funding, and the State Department of Health funds the program. Big P or little p? This is little p with a huge impact. So the story of this slide is that at big P level, the federal government lifted the federal ban on the use of federal funding for this harm reduction program, syringe exchange, which meant that states and local organizations could use federal funding for this. In 2011, they reversed the decision, so no longer could these things be used. But at the state level, the decision was made by community planning partners that the state could use state funding. So little p makes a big impact in this case. So your takeaways here are that health policy really means authoritative decision by governments pertaining to health. Policy is a structural determinant of health. it can take many forms, and that public health professionals need to sharpen their tools.